1 to 2 centimeters is about the size of robotic-assisted surgery incisions used. That's the size of a dime. Isn't that small? I'm interested in robotic-assisted surgery. This led me to talk about the advantages and disadvantages of robotic-assisted surgery, the types of robotic-assisted surgeries, how surgeons get trained to use the robotic machine, and lastly, the future of robotic-assisted surgery. Robotic-assisted surgery is becoming the most common approach in procedures. Not only is it better for patients, robotic-assisted surgeries allow surgeons to perform complicated procedures through tiny incisions, leading to more precise surgery. This leads to advantages for patients. The advantages of robotic-assisted surgery to patients are less pain and shorter hospital stays. One advantage of robotic-assisted surgery is less post-operative pain. Robotic-assisted surgery cuts smaller parts of your skin compared to traditional surgeries. What I mean by this is that robotic-assisted surgeries allow surgeons to use smaller incisions. The incisions are about 1 to 2 centimeters long. As a result of this, it also leads to the patient in less scarring. Robotic-assisted surgery also leads to the patient in less scarring because of not cutting a lot of your skin. For example, for open heart surgery, in order for the surgeon to access the heart, they will need to use long incisions cutting in your chest near your breastbone, and then your ribs will be spread open. However, for robotic-assisted surgery, in order for the surgeon to access the heart, they will need to use robotic devices, miniature cameras, and precise instruments. These are the advantages of robotic-assisted surgery. The disadvantages of robotic-assisted surgery are that it's only available in centers that can afford the technology and have specially trained surgeons. Your surgeon may need to convert to open procedure with large incisions, and lastly, there may be a risk of nerve damage. According to an article on robots in rural operating rooms in 2021, about 60 hospitals in the U.S. have performed 106 robotic-assisted surgeries. A lot of hospitals I know, including St. John's Riverside Hospital and Greenwich Hospital, do not have these robotic surgery systems. While you're in your procedure, your surgeon may need to convert to open procedure with large incisions, and there may be a risk of nerve damage. Nerve damage can be caused by compression, stretching, and ischemia. Ischemia can be caused by hard exercises or cold exposure. These are the disadvantages of robotic-assisted surgery. The surgeries that robotic-assisted performs are cardiothoracic robotic surgery, colorectal robotic surgery, and gastrointestinal robotic surgery. Cardiothoracic robotic surgery is heart surgery done through very small cuts in the chest. Colorectal robotic surgery removes cancerous portions of the colon and rectum. Lastly, gastrointestinal robotic surgery manages gastric conditions. The procedure involves cutting the muscles of the lower esophagus to allow foods and liquids to pass to the stomach, and gastric cancer. These are the surgeries that robotic-assisted performs. Surgeons get trained to use the machine by learning how to use the arms, learning how to use the console, and learning how to perform basic maneuvers. Robotic-assisted surgery works almost like a big video game. The surgeon sits at a console station and uses hand and feet controls to manipulate a separate surgical part attached to the patient. At training schools like the University of Alabama at Birmingham, surgical residents complete monthly tasks and practice common procedures. The resident, Teresa Botanov, obstetrician gynecologist, says the exercise helped develop skills that are precisely useful to the operating room. For one of these tasks, Teresa Botanov moves the robot arms to precisely place colorful rings onto matching spikes. If the students make a mistake, the machine will tell them. This is how students get trained to use the robotic machine. The future of robotic-assisted surgery is that as technology advances and robotic surgery systems become more advanced, the future of robotic-assisted surgery holds tremendous promise. Experts anticipate that the combination of AI and machine learning skills will play a more important role in the future. These technologies can assist in real-life decision-making and surgical planning. This is the future of robotic-assisted surgery. In conclusion, the advantages and disadvantages of robotic-assisted surgery, the types of robotic-assisted surgeries, how surgeons get trained to use the robotic machine, and lastly, the future of robotic-assisted surgeries are all the ways that help me find research into robotic-assisted surgery. For any more questions about robotic-assisted surgery, check out my blog post.